Good afternoon, Sir Rodriguez. I'm Sinead Belver, Patrimonial of BSN 1E. So for today's video, I'm gonna assess my patient's mouth, nose, and sinuses. So before I start, I'm gonna wash my hands and sanitize it with an alcohol, and I will put my gloves on. After putting my gloves on, I'm gonna start my assessment with my patient, but first I'm gonna ask her name. So good afternoon, Miss. May I ask your name?
My name is Jasmine.
So for today, I will assess your sinus, and first I will inspect your frontal sinuses, and I will inspect above the eyes, and I'm gonna cancel luminates by shining light upward under your eyebrows. Since I don't have ophthalmoscope, I'm gonna use my pen light to shine the eyes of my patient. Since since I don't have ophthalmoscope, I can see clearly the frontal sinuses of my patient, and we will now proceed to the maxillary sinuses. I'm gonna inspect below the eyes and cancel luminates by shining light below the eyes. So I'm gonna proceed to the palpates and percusses for tenderness. But first, I'm gonna palpate my patient's frontal sinuses. And then next, the maxillary sinuses. And then next, I will percuss the frontal sinuses of my patient. And then to her maxillary sinuses. As I can see, there is no tenderness of her frontal and maxillary sinuses. So next, I'm gonna proceed to her nose. Next, to inspect the position, the color, and the stretches of her nose. The position of her nose is in the center of her face, and then the color of her nose matches her skin, and then there is no irregularities on her nose. Okay, next, I'm gonna inspect my patient's internal nasal mucosa. So, Miss Pinili, can you please tilt your head? And then, by using pen light, I'm gonna inspect her nasal mucosa and turbinates. Can you please chin up? As I can see, there is no irregularities on her nose. The next, I'm gonna palpate my patient's patency of each nariz, and then the occlud's left nostril and her right nostril. Next, I'm gonna proceed to the mouth of my patient. I'm gonna inspect her lips for color, condition, lesions, and odor. So first, her lips is kind of pinkish, and there is no condition and lesions on her lips, and also there is no odor of her lips. So I'm gonna inspect my patient's anterior portion of lips. As I touch, my patient's anterior lips is smooth, and then I'm gonna proceed to the posterior portion of my patient's lips. As I touch, my patient's posterior lips is smooth. Next, I'm gonna assess my patient's teeth and bite. I'm gonna instruct my patient to open her mouth. So, Miss Pinili, can you please open your mouth? And I'm gonna check the number of my patient's teeth. So 28 is the number of my patient's teeth. The color of my patient's teeth is off-white and there is no condition of his teeth. So next, I'm gonna inspect her oral mucosa and gums. So by inspecting my patient's oral mucosa and gums, I'm gonna use this tongue depressor and then I'm gonna let my patient open her mouth. So Miss, can you please open your mouth? So I'm gonna inspect her oral mucosa. So her oral mucosa is pinkish and has a little bit white color. And then I'm gonna inspect her gums. As I can see, her gums are all good. Next, I'm gonna inspect my patient's hard and soft. Next, I'm gonna inspect my patient's palate, and then I'm gonna use my pen light to inspect the palate of my patient. Can you please open your mouth, ma'am? So her palate, so her palate are all in good condition. So next, I'm gonna inspect my patient's salivary gland, and I'm gonna use this tongue depressor and pen light to inspect. And then, Miss, can you please open your mouth? So I'm gonna inspect the Stensen's gland. Um, can you please lift your tongue, Miss Pinay? So I'm gonna inspect her tongue for the Wharton's duct. So overall, it is normal and in good condition. Next, I'm gonna inspect my patient's tongue. So, Miss, can you please protrude your tongue? So, I'm gonna inspect the color, the texture, and moisture of her tongue. So, the color of Miss Pinili's tongue is pinkish. And once Miss Pinili let her tongue out, it is quite moist for the texture and the moisture. Miss Pinili, can you please move your tongue? As I can see, as she moves her tongue, it is normal and quite small. So next, I'm gonna inspect my patient's oropharynx for color, lesions, and drainage. Can you please open your mouth, Miss? As I inspect, her oropharynx is kind of pale and I can't see any drainage. So next, I'm going to inspect the tonsil for color, size, and exudate of my patient. So Miss, can you please open your mouth again? So the color of my patient's tonsil is reddish, and the grading scale of my patient's tonsil is grade 3 because it is occupied between 50 and 75% of the pharyngeal space. So next, I'm gonna inspect my patient's uvula. Miss Pinili, can you please open your mouth and say ah?
Ah. Ah.
As I can see, her uvula is symmetrical. And then next, I'm going to palpate her lips for consistency and tenderness. I'm gonna palpate her tongue for consistency and tenderness by using this um, tongue depressor. As I palpate, her lips and her tongue um, has no sign for tenderness. I'm gonna palpate my patient's gland. First, I'm gonna palpate her parotid gland in front of her ear. Next is under the mandible. And then the sublingual glands under the mandible. As I can see, there is no abnormalities and it is all normal. Next, I'm gonna test her gag reflex. As I can see, it is all normal. And that's all for today's nose, mouth, and sinuses assessment. Thank you so much, Sir Rodriguez. But before I end this video, I'm gonna wash my hands and sanitize my hand with alcohol, and I'm gonna throw my gloves. Thank you and God bless.